Hi, my name is Rebecca, and I'm going to discuss preventing the spread of cholera in Indonesia. Cholera poses a risk to an estimated 1.4 billion people in endemic countries and causes 3 million to 5 million cases and 100,000 to 120,000 deaths every year globally. An estimated 50% of the cases and deaths worldwide are children under the age of 5. Cholera affects over 47 countries, is still endemic in some Asian countries, is epidemic throughout the years in African countries, and is ongoing in Haiti and the Dominican Republic. Virulent drug-resistant strains of Vibrio cholerae are emerging. Large outbreaks with high fatality rates have increased, pointing to a deficiency in early detection, prevention, and access to health services. Adequate public sanitation, safe water supply, and personal hygiene inhibit its transmission. Assessing community learning needs. What are the community beliefs about cholera? What are the barriers and facilitators of behavior change? Will most people in the target community accept the idea or methods? I chose to use the proceed model. Phase 1, social diagnosis, assessment of the target population's beliefs or misunderstandings about cholera. Phase 2, epidemiological diagnosis, assessment of the health of the target population. Do they know what cholera is, how it is transmitted, how to detect and treat it? Is information available on hand washing, feces disposal, water disinfection available? Do they have access to soap, chlorine, or toilets? How is food served and is hand washing performed before? How are dead bodies handled? Phase 3, behavioral and environmental diagnosis. Examine the behavioral and environmental risk factors related to the potential or actual health problems in the target population. Do they use toilets, perform hand washing, use water treatment techniques? Phase 4, educational and organizational diagnosis. Examine factors that affect behaviors. Identify antecedents that motivate the behaviors. Offer health information about the importance of sanitation, hand washing, vaccination, and water treatment. Phase 5, administrative and policy diagnosis. Select intervention strategies that address the health problems identified. Demonstrate good hand washing techniques. Teach water purification. Encourage breastfeeding and hygiene. Phase 6, implementation, involves implementing the designed interventions of the program. Phase 7, process evaluation, determine if the program has reached the target population and achieved goals. Phase 8, impact evaluation, evaluation of the change in behavior and impact on the target population. Phase 9, outcome evaluation, determine the mortality rate of the target population due to cholera. Health promotion, health education plan. Goal, reduce cholera deaths among Indonesian population by 90%. Behavioral outcomes, target population will demonstrate the ability to perform hand washing with soap, demonstrate how to prepare water and food, and proper management of feces to prevent the spread of cholera. Target population will receive a vaccination for cholera, and mothers will breastfeed babies for the first 6 months of life to increase immunity to cholera. Target population will verbalize understanding of signs and symptoms of cholera and identify treatment interventions for cholera. Evidence-based research. According to Papula and Mikhunu, health education status of mothers and caregivers is a variable that community health nurses can manipulate to improve the survival chances of under 5 children. The importance of breastfeeding, sanitation, and personal hygiene was incorporated into the teaching plan. Harris et al. Suggested that replacement of fluids is vital to the management of cholera. Education on the fluids used to rehydrate individuals with cholera and the importance of preventing dehydration was incorporated into the teaching plan. According to Ivers et al., oral inactivated bivalent whole cell vaccine was effective in a cholera epidemic. Education about the vaccine and encouraging vaccination was incorporated into the teaching plan. Evaluation of the health plan. The World Health Organization cholera outbreak tool for evaluation was utilized to guide the evaluation process of the health plan. Evaluate the target population mortality rate from cholera infection. In all, educating the community about water treatment, sanitation, and good hygiene practice is vital in reducing the rate of cholera infections. Encouraging immunizations along with breastfeeding and educating the community on the benefits can increase the number of individuals that have immunity. Illness and death due to cholera can be reduced with early prevention, detection, and treatment. And this is the list of references that I utilized. Thank you. How to save the video?